Hey, Mona. Can you hear us?
Sorry, I was going to say good morning.
Oh, good morning.
It's been a long day.
Having lunch?
Yeah.
So I'm Carl Cirio. I'm the Interim Clinical Director, Chief Medical Officer of the institution. And what that means is that I have responsibility for the delivery of the clinical care here and oversight of all the practitioners. We've done a lot of work to ensure that patients, as they come into the institution, have a safe and good experience. That's required a lot of work on our part to train the staff, all staff, not just the medical and nursing staff, but the entire staff. First of all, let me step back a little bit. We've been really fortunate here to have a great supply of PPE, patient protective equipment. And that's important because a lot of institutions in the country have struggled with supplies, so we've had the good fortune of having enough equipment. Having said that, we've done a lot of work to both train people, but also make it really clear that for the interests of patients, the staff, and all of our families, it's an absolute mandate that people wear and utilize PPE appropriately. And we're doing that. We have great compliance.
My name is Danelle Smith, and I'm the CEO at Winnebago Comprehensive Healthcare System. I'm responsible for oversight of the entire organization. The Winnebago Comprehensive Healthcare System is comprised of the Winnebago Public Health Department and 12 Clans Unity Hospital. One of the steps that we've taken at 12 Clans Unity Hospital is that we've implemented a drive-through pharmacy. So this allows our patients to be able to obtain their medications without actually having to enter the facility. And so our pharmacy department has made a lot of steps in order to implement that on a very quick basis, but really just trying to keep operations efficient and make sure that our patients are safe. So patients can come to the front of the facility and a pharmacist will be there to greet them and get their medication, and they can be on their way. It's really a quick and efficient and safe way to get their medication.
Yeah, we're very excited about some of the things that we're going to be starting. One of the things is a shoe sanitizing station. And so what that would consist of is you would come in to the hospital, you'd stand on a platform, and there's UV light underneath that platform that will sanitize your shoes. So then when you walk off the platform, your shoes are sanitized from the ultraviolet light. And that can be used multiple times during the day. It can be used when you come into the hospital, the employees, patients can use them, and it can be used when they leave the hospital or even certain times of the day. We also are getting a UV, ultraviolet light robot, which what happens with that is that robot can go into rooms, and you leave it in a room for a certain amount of time period, and it disinfects the entire room. And we're excited. People do have them, there's hospitals that have them, but not many our size.
We're really excited to be opening up the clinics. I think it's really important to everyone to understand that coming in for preventive and routine care is really important, especially since many people have delayed it over the last several months. Two populations. For kids, it's really important that they get not only their immunizations, but their well baby checks so that in fact they can be shown to have appropriate growth and development. And then for adults, in addition to chronic care for diabetes, hypertension, and other chronic illnesses, it's really important that people get their immunizations. But for instance, for women, the routine mammographies, the routine pap smears. So we are really welcoming and encouraging people to get back into the routine of coming in for their preventive screening tests.
So to make an appointment at the clinic, you would need to just call the outpatient clinic, 878-3404, and then just talk to the nurse, and they will get you a time that works for you. We do want to put people that are well, like if you're coming in for a school physical, or if you're coming in to get immunizations, we want them to come in the morning. But if someone is sick, we prefer they come in the afternoon. I don't know if everybody knows, but right now we do outside testing or a drive-up testing. And we've just really been testing probably since the last 2 weeks, just people that probably are symptomatic, employees. But now we are opening it up to anybody that wants to request a test. If you feel like you need a test, you just need to call the clinic and they will schedule a time in the drive-through testing. And you may not get in same day. Right now we're not full, but once we start getting more people, it may be the next day that you can get in, but we'll get you in as soon as possible. But then you just, we register you over the phone. They'll ask you some questions at the drive-through testing, and then it takes about 3 to 5 minutes to get it done.
At 12 Clans Unity Hospital, we've taken great effort to try to ensure that both our staff and our patients are safe.
It's really important for people to understand that we're really excited to get back to some somewhat normal operations, recognizing that we still have some constraints in terms of protective equipment and the like. The staff is really excited to get back to something of a normal approach to patient care because there has been a concern among many of us that in fact people have not been able to access care as they might otherwise in normal times, getting their preventive care, getting their immunizations, getting their blood pressure checked, getting their diabetes checked. So we're all excited about having y'all come back.
We have implemented quite a few safety measures. When you come into the hospital, you'll notice that we have some barriers up so that people can safely social distance. That's in the waiting areas. We have put some markers on chairs so that we don't want people sitting right next to each other. Again, social distancing. We have face masks available for everybody. We want everybody, all of our employees wear face masks. We want visitors, our patients, everybody to be wearing face masks when they come in. If you don't have one, we'll give you one at the door. We still screen patients, visitors, employees that come in the door, to see if they have a temperature. We ask them the questions. We're going to be focusing on our cleaning, and we're going to be stationing somebody out in the clinic areas, in the waiting areas to clean very well what we call the high touch areas, things that people touch frequently, and just wiping those down so that people feel safe when they come in.
Good afternoon, Winnebago community, Winnebago membership, and Winnebago workforce. This is the weekly COVID-19 update for the Winnebago tribe of Nebraska. And I wanted to start off by acknowledging and paying the respect and offering our condolences to the family that's in mourning today. There was a community member, had a father and a husband to tribe members, and we really acknowledge that, and he was a member of this community. So I wanted to start off by paying those respects. And I also wanted to offer a word of encouragement to everybody and reassure them and try to provide them with a little bit of energy to keep on going, and to understand that everything we're doing is real important for our most vulnerable ones. And with school starting, I want to encourage and reassure everybody that works within the school to take those safe practices and understand that we work with children, or maybe even you have an elder at home, and you understand that you always carry that with you wherever you go and whatever you do. To say I can't come out or I can't do that. I work with children, and that's a 24-hour thing that you always got to acknowledge and keep the children safe in your own life and even on your own time. So I want to thank you and I want to encourage you as we move forward with the education. And with that, I wanted to pass it along to the weekly presentation by our Winnebago Comprehensive Healthcare System. Thank you.
Good afternoon, everybody. My name is Danelle Smith, and I thank you for joining this week's live stream presentation. I too would like to express my condolences to the family who lost a loved one today. And also just want to remind everybody really quickly that we posted a survey on the Facebook page for the hospital this past week, asking for input on the format and the content for the weekly live stream. So if you haven't already done so, I would encourage you to fill that out. We really respect your time, and we want to make sure that the content that we are providing is useful to you. And other than just reminding everybody to stay safe, wear your mask, continue to practice physical distancing, I don't really have a whole lot to share today. As school opens up, like John said, I know a lot of people are really nervous about what's going to happen. I know that the school administrators have done everything that they can to try to make the best of a very challenging situation. So I would just really encourage you to try to educate your children and take all the precautions that you can as a family and as an individual to stay safe and keep everybody else safe that's around you. And with that, I'll turn it over to Mona.
Good afternoon, Winnebago community. I also want to extend my prayers and thoughts to those in mourning today. So we'll go ahead and get started with our community updates. So our current status in Nebraska has tested a total of 309,938 negatives were 280,400, positives were 29,244, and our deaths were 356. Those in non-Winnebagos but tested at the 12 Clans Unity Hospital, there was 510 tested. Out of those, 424 were negative, 85 were positive, and we had 1 pending test. Here in Winnebago, we have tested 612. We've had 515 negatives, 97 positives, 90 of them have recovered, and we've had 3 deaths. So some of the things that are still constantly important is protecting yourself, of course, is wearing a mask, keeping your 6 feet distance if you can't wear a mask. Parents, it's so important to have masks on your children, of course, those that are over 2, and social distance to prevent infection. We've been asked many times about our teens, and we want to make sure that we continue to tell them the same message is wear your mask where it's appropriate as much as you can, keep your physical distance, which is 6 feet from other people. And we've had some questions in regards to taking care of someone that is positive inside your home. We try to isolate them as much as possible. That does not mean that we just keep them in one room and shut that door. But basically it sort of is, so they can still move around, but they have to wear their masks when interacting with anyone. Family members should wear their masks. You disinfect after that person has come through or has touched any of the surfaces. And everybody's symptoms really range from mild to severe, and it's really hard to tell who's going to get what. And so that's why it's so important to wear your masks and social distance. It's just preventative. And so that's all we're constantly trying to convey to people and encourage people to do. And I know that's what we're all trying to do, is the best that we can. So I will turn it over to Laura for some of the hospital process updates. Thank you.
Right, thank you, Mona. So some of the process updates that we have currently at the hospital, individuals who come into the hospital with the intent of selling food products will not be allowed on the premises. This rule has been implemented to ensure compliance with infection control regulations, and it also ensures patient and staff safety. Just something that we have decided that we need to do right now during this time period. Current patient, employee, and visitor screening processes are under review, and they are being evaluated periodically. We have a multidisciplinary group. A bunch of us get together and we talk about the screening processes very often here at the hospital. We have begun to utilize thermal temperature checks for both patients and visitors. All patients and visitors should use the east entrance by the emergency department when coming in the building. The front entrance of the hospital is only to be used for employees and the drive-up pharmacy. We've had some people wanting to come through that door, but we want everybody to go through that east entrance. Staff is continuing to self-evaluate and report any symptoms prior to coming into work. And PPE, such as masks and eye protection, are mandatory for staff, and masks remain mandatory for patients. All right, we do have the new UV disinfection robot, and I was going to let Danelle say the name. I've been trying to learn it, but I'm going to have Danelle say the new name, and this was a name that was voted on by those people that we did a survey with, and we had quite a few names, and this was the name that came up.
Thanks, Laura. So our new UV disinfection robot is named Janitor in Ho-Chunk. And granted, I'm not a fluent Ho-Chunk speaker, but our UV robot's name is Chigi Shinchka. And so we are all going to be posting that around and sending out our audio files so that we can all learn the correct pronunciation and have that as part of our safety equipment that we've implemented at the hospital. So everybody's pretty excited about that. This is just one of the many pieces of equipment that we purchased as part of the CARES Act funding that was allocated to the health organization by the tribe. And this robot is very critical to help us with prevent infections and cross-contamination. And it's an ultraviolet disinfection technology that will help to deactivate the COVID virus in the facility. And so our staff is being trained on it, and it will be deployed throughout our facility so that we can make sure to keep it clean and keep everybody safe.
All right, that's all we have today. But thank you, everybody, for tuning in, and we'll have more for you next week.
Thank you to the Winnebago Comprehensive Healthcare System, 12 Clans Unity Hospital, as well as the Winnebago Health Department. This week, the CEO of Winnebago Tribe doesn't have any updates. As always, she just wants to remind the viewers to make sure to check out the website, winnebagotribe.com. Also to tune into the Winnebago Tribe's Facebook for any updates that are coming up as well. So we'll turn our attention over to the Winnebago Public Schools, Dan FEHRINGER. Dan.
Good afternoon, everyone. Again, I want to express our condolences to the family in mourning. We have some breaking news, and that is we just found out a few minutes ago that the All Nations High School Football League, which we were going to be part of this next year, has canceled the fall season, and they're moving it to the spring. So we're in the process right now to petition the NSA, the Nebraska Schools Activities Association, to allow our kids and our coaches to be involved in that season next spring. So we'll find out more as we move on. But the football season is not going to happen this fall as far as the high school. All other fall activities are still going on as planned. High school cross country and volleyball will start Monday, August 17th. Junior high cross country, volleyball, and football, junior high football, which we'll still have, will start on August 31st. A code of conduct can be picked up at the front desk. Again, the board approved the return to school plan Monday night at the board meeting. It can be located on the WPS website and WPS Facebook page. A reminder that the first day of school for students, both homebound and in person, is Tuesday, September 8th. Also, those students, academy students enrolled in Little Priest dual credit courses, that starts, I believe, on August 24th. So those are some things that are coming out. Parents and guardians of students choosing the homebound remote learning educational setting are being contacted by our staff to set a meeting up for starting tomorrow, and to review the contract requirements and sign the homebound remote learning contract. They'll go over lots of information. It will be with an administrator, either Mrs. Tremaine, Mr. Goebbels, Mr. James, or Mrs. Burrell. The last thing I have today is physicals are required for all incoming kindergarten students, incoming 7th grade students, any new student coming from out of state, and any freshmen wishing to participate in athletics. Incoming 8th graders, sophomores, juniors, and seniors who participated last year in school are exempt from needing a physical unless they didn't participate last year. Then they will have to have a physical. Again, we're echoing everything else. Continue to practice safe health safety measures, wear masks, and parents, please work with your young kids and have them put a mask on at times so they get used to it. Our staff, we have staff that have been back now this week, and we're all practicing the safety things. So again, continue to practice safety measures. Thank you.
Thank you, Dan. At this time, we'll turn our attention over to Little Priest Tribal College, President Patil. President.
Good afternoon, members of Winnebago Tribe of Nebraska. Before I get started, I just want to share my heartfelt condolences to the family in mourning. Here are the updates as a Little Priest Tribal College starts its first completely virtual fall semester. If you're a new student to Little Priest Tribal College, the last day to register for classes is August 21st, 2020. Please contact Maria Garcia or Sanaya Carrillo to register for as a new student. If you're a returning student, the last day to add a class or classes are August 26th, 2020. Excuse me. Please contact your faculty advisor to register for classes. If you complete your FAFSA application, and if you're a Title IV eligible student, full-time students, that's 12 credits or higher, will get 2 free classes, including free textbooks and a free Chromebook or a laptop. If you're a part-time student, that's less than 12 credit hours, you get 1 free class, including free textbook and a free laptop or a Chromebook. Please contact Yati Muhammad or Ashley Coons in the Office of Financial Aid at the college. Please note, a FAFSA application must be completed to use any of these federal tuition grants. Fall 2020 student orientation will be conducted via Zoom session. The first session is on Thursday, August 20th from 3 to 4 p.m. And the second session is on Friday, August 21st from 12 to 1 p.m. Additional sessions may be conducted as needed. Zoom information will be shared on website, Facebook pages. Please contact Alicia Turnquist or Tricia Wagner for more information. Canvas is our learning management system. If you need to access Canvas or having difficulty with Canvas, please contact Maury Conway or Bryce Anderson at Office of Information Technology. Classes start on August 24, 2020. We want to make sure the students are ready from the day one. If you try to register at the last minute, you will miss out on some of the initial materials of the course. So I really want to emphasize today to register for the classes. Please get your textbooks and laptops and be ready from the day one. Completion really matters. If you want to meet a college official or drop off documents, please note there will be temperature health screening at the entrance at the college. Once you arrive at the parking lot, please stay inside the vehicle and call the required personnel. A college official will meet the student in the parking lot. If you have a temperature of 100.4 or higher, you'll not be allowed to enter the campus. Student, guests, visitors are not permitted inside the buildings without prior approval. There won't be any exceptions to this rule. We want to keep our employees safe at all times. Starting August 24th, students can use college's Wi-Fi by driving to the campus and staying inside the vehicles at all times. If you log into our college's access, you get high-speed broadband access to complete your coursework. If you do not log into our college's portal, you'll be getting free, low bandwidth internet access. As you enter the campus, you will be asked to wear a mask. If you don't have a mask, one will be provided at the entrance. Students must wear masks if they are interacting with employees or fellow students on our campus. Again, the school starts in another 10 days. We as a college are very excited, even though during this pandemic, we have ups and downs. We are excited and we want our community, our children, not to stop learning, but to actually use this time to complete higher education. So again, on behalf of the college and the Board of Trustees, I want to welcome all the community, our students, to Little Priest Tribal College. Thank you. God bless and have a good day.
Thank you, Manoj. We appreciate the update. And as always, they have a website. Make sure you check out their website and get registered. I've seen that a flyer for the virtual online orientation is coming up. So thank you once again. At this time, we'll turn our attention over to the Winnebago Casino. Mayan Beltran, General Manager. Mayan.
Good afternoon, everyone. I'd also like to offer my sincerest condolences to the mourners today. Weekly updates for Winnebago Casino Resort. We are implementing within this next week as well the thermal readers for temperature, and we'll be utilizing those for other amenities as well, each entrance and for the employees. So we're excited to put those in there. Less intrusive with somebody pointing a temperature gauge in your face. You get to walk up, it then measures your temperature, and you can come in the casino at that point. As always, we're still requiring masks, no smoking, and must be 18 or over at the casino at this time in phase 2 with expanded hours of operation. One last thing to announce today is that we recently postponed all concerts until 2021. So the concerts that we had scheduled for this year will be coming back in 2021, but due to the uncertainty of this pandemic and the marketing that's required to make a concert happen, sell tickets and do it, we just don't know what's going to happen in the next few months, so they have been postponed till 2020-21. So that's all we have for announcements right now from Winnebago Casino Resort. Thank you very much.
Thank you, Winnebago. And now we'll turn our attention to Ho Chunk Incorporated, Communications Manager, Sam Burrish. Sam.
Good afternoon. Thank you, Garen. First, we'd like to express our sincere condolences to the family in mourning. I do have a brief update today. Ho Chunk Farms has started its Indian corn harvest, and that is continuing until all the corn is picked and processed. They planted much more than last year, So community help is much appreciated. Community members do get to keep a portion of the corn they help process. This is currently happening at the Village Market behind the Dollar General and will continue tomorrow into next week. Please wear a mask and socially distance. You can learn more by finding Ho-Chunk Farms on Facebook or contacting Farms Manager Aaron LaPointe. The other update is our Sweetwater Cafe location in Winnebago. Starting August 17th, location hours will extend to 4 p.m. They will also start limited seating for dine-in at the same time with safety measures in place. The Sweetwater location at the Ho-Chunk Center in Sioux City has been closed and will reopen on August 11th. Please follow their Facebook pages or call for more information. Those are the updates I have for today. I thank you for your time.
Thank you, Sam. And do we have Brian on? Nope, I don't see Brian. How about, do we have the United States Census Bureau? Caller 04, is that Harmon? Are you on?
Yes, hello. I am on. Good afternoon, everybody. Hello, Garen. Thank you for having me. I'm going to give you a couple quick updates about what's going on with the census. Due to COVID, it was originally supposed to be the end of April, but because of COVID, it got moved back till October. Now, we recently received a directive that October date is no longer accurate and will be moved up a month until the end of September. So with that being said, we have one less month to respond to that census. And I understand that you've received Chromebooks and there are now Wi-Fi spots available around Winnebago, and this is a real game changer in terms of responses. We ask that you bring your questionnaire. If you have your questionnaire, on that questionnaire there will be a census ID number, and that's a 12-digit code that has numbers and letters in it. You can respond that way. If you do not have your code, it's still okay. You still have the ability to respond. You'll just have to enter your address instead of that code, and hopefully that code will tie to the address that you're responding from. We're looking for some dates and times that we can have a questionnaire assistant set up, mobile questionnaire assistance. And we will have $25 gift cards as long as those supply lasts. So the earlier you get there, the better. We're still waiting on establishing some dates. Once you're done filling out that questionnaire, if you've done it prior to our events, take a picture of it with your phone and bring it to us, and you'll still be able to qualify for that gift card. That's all I have for today. Thank you for your time. If you have any questions, you can contact me at harmon.t.maples@2020census.gov. And to respond to that questionnaire, you can also go to 2020census.gov, and it's the first thing that pops up. It'll say shape your future, start here, and then just click on the respond button and you can fill your questionnaire out. Thank you.
Appreciate you with that update, and definitely one of the things that the Winnebago Tribal Council and everybody would like to reinforce is that the census is very important. So we appreciate Harmon and the update, and please keep us updated, Harmon. At this time,
thank you, Garen. We'll do.
Yep. At this time, we'll turn our attention over to Emily with the question and answer session, and then we have some questions here for the Winnebago Public Schools and also the Pandemic Task Force Chairman. So stand by, everybody. Emily.
Thank you, Garen. We'll go ahead and start the questions that were submitted from this past week for the healthcare officials. Again, you could submit any question you have to covid@winnebagotribe.com. That's the email any question, or you could also comment down below on the comment section on Facebook or on the tribe's YouTube page, and we will get those questions and answer them as they come in. So the first question is in regards to the COVID cases. Are the numbers going to rise again because they are nationally? Mona, can you answer that question?
I think it's probably really hard to determine whether we will mimic exactly what the national stage is doing, but we have to be constantly being aware and watching and be prepared for them. With more people trying to travel around, it's more than likely we will increase. We report those increases to the community as soon as we're aware of them. We try to get our community members in isolation and their close contacts in quarantine as soon as we're notified. Our isolation and quarantine housing is now available. So if someone is uncomfortable in letting their PHN know that you need alternative housing, you can always contact me directly and we can work with you and your family to get you to the appropriate locations.
All right, thank you, Mona. The next question was in reference, I believe, to the UV robot. It said, how do you say the drone name, which is a UV disinfectant machine, and what does it do? So Danelle already was so kind enough to review that for us. So thank you, Danelle. The next question is in regards to the CARES Act money. The question is there another round of CARES money coming from the federal government? If so, how much and what's the plan for that money? Danelle, can you answer that for us?
Yeah, as far as I know, the tribe has received all of the CARES Act funding that's been allocated. There were 2 rounds of funding, and that's been distributed to the tribe. And so the CARES Act itself is done. Congress is considering another COVID-19 relief package, however, and so there's still some debate between Congress and the president about what that's going to look like and what all of that's going to entail. So that is yet to be seen.
Okay, thank you for that information, Danelle. The next question is, the people helping with Indian corn are they getting temperature checks by the health department? That virus could spread by food if someone is over there helping that has coronavirus. Mona, can you address that?
So the virus, as far as we know, has not been transmitted through food. The transmission that was noted was from the surfaces that the food is on, like if it's in a prepared package. So my understanding is that there are masks available on site and asked to be worn. I did want to also remind people that temperature checks are only one tool. And unfortunately, many times the patients that are identified within our system have had several other symptoms, and some have never developed a fever. I want to remind people that a close contact is considered to be someone that is not wearing a mask closer than 6 feet for more than 3 minutes. So that's why it's so important to wear your mask and have your distance. If an event is occurring and they need assistance with temperature checks, then they need to contact the Medical Services Director, Cindy Aldridge, at 402-878-2277 to assist with. The Winnebago Public Health Department has developed an events form that we will be placing on our website, and we will be asking for any event that takes place in Winnebago to please fill it out and submit it to us so that we are aware and we're able to assist when needed.
Okay, great, thank you. The last question is there anything we can do to help with the COVID response? Mona or Danelle or Laura, either of you, do you want to take that or answer that?
Well, this is Laura. For me, I think it's just do exactly what Mona just said. You know, wear your mask, so social and physical distancing. You know, for us at the hospital, it's following the advice that we give. You know, coming into the correct entrances. You know, helping our staff, being, you know, kind and just, you know, really working with the processes that we have here at the hospital, and knowing that not everything is perfect, but we're trying to do what we can every day.
Okay, great. Thank you so much, Danelle. Oh, sorry. Go ahead, Mona.
Oh, I was just going to say, you know, we have most of the basic needs, of course, met for our quarantine and isolation families. But if anybody would like to donate to them, we will certainly take any disinfection supplies like paper towels or cleaner, Clorox wipes, or any basic food supplies that people can use in the microwave or canned food. We can get them to those families in need.
If people want to donate, who do they contact?
They contact our Poor CHR program. So 878-2277. But like I said, we have most of everything, but if someone would like to, they certainly can.
Great, awesome. Thank you so much. That concludes the health related questions. Garen, I'll turn it over to you. I know there was a couple other questions regarding some other organizations.
Thank you for those question and answer sessions. And yes, we do have some questions that just came in. Dan, this one is for you. This one's regarding the announcement of the football season. They want to know why football is canceled, but not volleyball. Both are close contact sports. Can you address that question, please?
Yes, I'll do the best I can. The All Nations Football League is composed of 14 South Dakota schools and 2 Nebraska schools. A majority of the South Dakota schools are not going to have fall sports. And so there were 6 teams left, and it was decided that we couldn't have a competitive season with just the 6 teams. So the board of directors for that All Nations League voted to move it to the spring. And right away, we would have still had football if we would have been playing in Nebraska. But we moved it to South Dakota to play in the 9-man All Nations League up there. And that league composed of schools like Marty, Flandreau, I believe Laurel Brule, and I'm not sure. We even had a school in North Dakota, Standing Rock, I believe. So that was a decision of the board of directors from that organization. And again, we're going to follow all the guidelines and health safety measures that we put into place in the previous when we are going to have athletics. And we'll be visiting with the health department throughout that process. But the main reason, it had nothing to do with us. And so right away we got on the phone, and Mr. James is in contact with the Nebraska Schools Activities Association. In fact, he was on a call just a few minutes ago that came in with their people, because they have to work through the process as it's new to everybody, and we can't have 2 seasons, so we can't even come back to the Nebraska football season at this time because all those schedules have been out. And so that's kind of where we're at right now. It has nothing to do with, we still have to follow all the guidelines for all the other sports. That's one reason we're still going to have junior high sports, because we still have that schedule. It just, the varsity was up in South Dakota League primarily. If there's any other questions, we'll get more information as this moves on.
Thank you, Dan. Now we have some questions for the pandemic chairman, John, and I think Harmon's still on here. They're kind of geared towards the census here, so we'll have John take a stab at answering the question, and then we'll have Harmon see if he wants to kind of chime in on that. What's the tribe doing about filling out their census forms so they are counted? That's funding for the kids and elders in the village. John.
Yeah, that's a very good question, because it is really important that we fill that out so we have an accurate number of our community, and it can benefit our community in many ways, accurate census for us. And I believe I've seen a number of 32% we're at. So we have some work to do, and I would encourage all the tribal members to fill out that census, or all the community members to fill out that census, as it's important. And as you can see on this live stream, we're working really closely with Harmon, and we're really trying to accommodate and help him, and because it benefits us. And if Harmon wanted to add anything to that, I'll open it to him right now.
Yeah, thank you, John. Just want to give you an update on those response rates. We're now up to 33.7%. So just over a third of tribal residents in Winnebago have responded. But with time getting shorter, you know, there's really a sense of urgency right now because a lot of this funding will go towards programs like Head Start and education and infrastructure. And the data that's gathered is used to apply for grants and for other programs. It's not necessarily coming from the enrollment department at Winnebago Tribe because they're different. So I urge everybody, you know, to fill out that census as quick as you can, and, you know, let's keep some money up there and some more resources so that, you know, the community can get the resources and have access to the resources that it needs and deserves.
Thank you for that response there, Harmon and John. Next question towards John here. What's the tribe's stance on making sure we can all vote and it's counted come presidential election time?
Yeah, so obviously it's very important, the President of the United States, and making sure that that our voice as a tribe is heard, and that we're encouraging our members to partake in that vote. So we work with the communications and we make it available, and but it comes down to each person. So at this time, that I would encourage each one of you to utilize your right to vote in those elections, and it's important, and just thanks, Garen. Thanks.
Yep. Thank you, John. Here's a question for the health
Garen?
department. Go ahead.
Hey, Garen, before you move on, can I add to that that question, or the answer to that question? One thing I think everybody, as far as the Nebraska and national presidential election goes, is that in Nebraska, everybody is allowed to vote by mail. And so that is one way that every voter can make sure to keep themselves safe and also have plenty of time to review their ballot and do research on the candidates. And you can request your ballot to be sent to you by mail, and then you can just mail it in at your leisure before the deadline for that. And so maybe we can share some information about how to go about doing that and the deadlines on the tribe's Facebook page.
Awesome. Thank you for that very beneficial information. Another question regarding the census here, John and Harmon. If they go around and start knocking on doors, what's in place to keep those people safe for those that are going to be coming around knocking on doors, as well as those that are receiving the packets? Do you know that?
Yeah, I can take that, Garen.
Okay.
Each enumerator, the people that will come around knocking on doors, will all have PPE. They'll have masks. If you want them to wear gloves, we can give that directive, and they will wear gloves. No enumerators will enter the home, and they will maintain that 6-foot distance, you know, to limit exposure and contact with the tribal residents.
Perfect. That's what we need to know. Thank you. Last question that we have here, directed towards the health department. Are there still health educators employed with the tribe? If so, what are some of the examples that they're doing at this time during the pandemic?
Sorry. Yes, we have several health educators that are employed and working at this time. Some of the activities that they're doing is some of the virtual activities. We've had Project Launch being at the Kids Cafe, providing education there. They've had different activities where the kids had to check in, and they provided a drop-off place where they could pick up their incentive. So those are the main activities were towards the children.
Awesome. Thank you for that response there. And we're just going to pull up the Winnebago Health Department's website. There's a tab on there. It says click here for the latest COVID-19 information. This is at winnebagopublichealth.com. So you can see the directory, the leadership, about employment, the news, the contact, all kind of good information here. And then they also have a link to their Facebook page. So make sure you folks like their Facebook page. There's about 1,500 people that are tuned into the Winnebago tribe. So we have some work to do on the likes. We have 604. So if you want to hear the latest information on the Winnebago Public Health Department, make sure that you do that. And they also have a survey. And we've been kind of passed around some surveys recently to get your guys' opinion as well as your feedback. So we appreciate that. Also, we just got information about the early voting process, and here's their website. If you go to nebraska.gov, elections, /early voting, here's the things that you can do to do that. So make sure all Native votes count, and we want to definitely promote that message, especially you. And it's coming to Election Day. November 3rd is Election Day for, we'll see if a new president or how that race is going to turn out. But as you can see, there's some dates and some deadlines coming up. The next one coming up is September 28th. And so those are going to be being mailed out. October 5th, early voting in the county election offices begin. October 23rd, last day to request a ballot to be mailed to you. And then November 2nd, 2020, last day to vote early in county election office, and then November 3rd is election day. So we appreciate those that submitted their questions, those that tuned in, and as always, please keep wearing your mask, social distance, use hand sanitizers, and please be safe out there. We want to thank everybody that tuned in today, also all those that jumped on, John, Mona, Sam, Emily, Mayan, Laura, Danelle, Dan, and Harmon. And with that, we're going to end the live stream, and we'll see you folks next Thursday. Thank you.
Thanks, everybody.
Thank you.
Thank you.